Okay, this is your lecture on bronchial asthma. I know this is not a very difficult topic to understand because maybe you know someone or maybe you have bronchial asthma. So technically, this disorder is going to just take, quite some simple recall of your anatomy and physiology plus your immune system and your inflammatory response. Okay? So by definition, your bronchial asthma is a chronic. So I mean chronic, ibig sabihin nun, paulit-ulit ito. It's long term. Chronic inflammatory disorder of the airways that causes varying degrees of obstruction in the airways. What are your airways? Bronchial, tracheal, your bronchioles. Those are your airways. So it is marked by airway inflammation. So let us put for a while. Let us underline that one. You have your airway inflammation and your hyperresponsiveness to a variety of stimuli or triggers. You will never have your bronchial asthma unless there are your triggers. Um, it's like it's a disease that has your phases of your remission and your exacerbations. Similar to understanding that a disease can actually hide for the meantime, but when it comes out, you will have your exacerbations. So it's like a cycle of remissions and exacerbations, specifically that this is a long-term inflammatory disorders of your airways. So again, there are two components that you have to remember with this one. You have your airway inflammation, which is actually chronic in nature, and you also have your hyperresponsiveness to your triggering factors. So that is your bronchial asthma. What are the triggers? Ano ba itong mga nag-initiate sa atin ng inflammatory response? Na, first one on the list will be your allergens. So, hypersensitivity, ibig sabihin nun, allergic ka sa mga substances such as, for example, here, you have your outer in the environment, you have your trees, your shrubs, these types or specifications of plants that can actually trigger you to have these attacks, your acute attacks. You have your indoor, mga dugyot, dust mites, mold, cockroach antigen, all of these things are considered also as allergen. Next, you have your exposure to your occupational irritants. If you're a driver and may asthma ka, hindi pwede yan para sa'yo. Yung job na yan para sa'yo, hindi yan pwede para sa'yo. Unless if you have taken precautionary measures like you have what your mask on. Still, you are at risk for experiencing asthma in the long run. I know for a fact because um, I have an aunt who works in Holcim Cement before. Actually, dati, hindi yan Holcim, it's your Union Cement, right? So, she worked there as an HR personnel for like years, maybe 5 years. When she first entered the company, she was fine and nothing was wrong with her. But since she was exposed to the dust coming off from the cement factory for that 5 years that she has been there, she has developed your asthmatic attack. And it was not um ano to, and it was not the mild one, it was the severe one, enough to have sent her to the hospital several times. So after the fifth year that she was working in union, eventually she resigned from her job and focused on to becoming just a home manager or yung housewife na lang. Because my uncle already went abroad. Okay, lucky for her, she has a financial um, a partner who can provide well for the family, si uncle ko. So yes, that was the irritant that caused her to have very, very severe attacks of your asthma. And that is because of the nature of her job. So there are several types of jobs which or occupations which might predispose the patient to being exposed to these irritants. Exercise, yes, there's such thing as for everyone's information. We always associate that doing your exercise is actually good. However, if it's overdone, you might end up not only hurting yourself, but eventually developing certain types of illness. Like for example, this one, we have what we call your exercise-induced asthma. Nasobrahan si kuya at si ate sa pagka-exercise, hindi pala nila alam na meron palang silang asthma. Pwede pong mangyari yan. Cold areas, any changes in temperature, whether it's very cold or very warm, it actually is a triggering response for your bronchial asthma. I know that for a fact because yung pamangkin ko tsaka yung kapatid ko, um, actually everyone in the family is asthmatic except for me. Sabi ko, I think I have mentioned this one to you already that I only have your allergic rhinitis, but I don't know right now because earlier on I have um, started doing nebulization again because I don't know. Hindi ko alam kung anong meron sa akin ngayon because of my coughing fits early this morning, at night, and even today. Sobrang grabe yung ubo. Hindi ko alam kung paano. And the only thing that can actually alleviate my coughing fits was the nebulization from the bronchodilators that I have. Usually, um, for everyone in the family, whenever they have their acute attacks, yung go-to management talaga nila is your nebulization. Walang paltos yan. Then again, this is the second time that I appreciated the effects of your bronchodilators because really, I stopped having coughing fits and I can breathe appropriately. So, yun nga, cold air, yung sinasabi ko, my sister who worked in a ship, in a tourist ship, parang ganun. Um, she has been to cold countries. There was no complaint at all. I think she likes the cold weather. But when she came back to the Philippines, because 'di ba, nag-stop yung operation nung ship because of COVID-19. When she came back to the Philippines, nanibago yung katawan niya. And because there was extremes in the weather and the temperature from very, very cold and then suddenly it shifted to your very hot temperature, very tropical country, Philippines. Nanibago yung katawan niya so that when she arrived here, she was diagnosed to have COVID when she arrived in the Philippines. So sobrang apart from having that infection, she also had difficulty in dealing with the very hot and humid climate we have here. To the point na uh, yung sabi niyang gumaling na siya ng COVID, it was again aggravated by the very, very humid temperature. Na nung nandun siya sa isolation facility, she needed to have your close care monitoring, naka-oxygen tank siya. Meron siyang pulse oximeter, as in siya lang yung parang sa isolation facility ng mga OFWs doon sa Philippine Arena. Yun yung sobrang hirap na hirap siya. Kasi I think even if Philippine Arena was air conditioned, but the weather was really, really bad. It was very, very humid. I think she arrived mga around uh, July last year. Eh hindi man rainy season yun, kahit July na. Sobrang init pa din. Kaya from the time that she was sent to the isolation facility, sobrang hirap na hirap siya. She was having her bronchodilators, nebulization every now and then. She was on O2 oxygenation like 24/7, and she was on close care monitoring. Hirap na hirap magsalita. When she was swab negative, so pinauwi dito sa La Union. Pagdating dito, sobrang init na naman. Even if she was isolated in her room for like 2 weeks, maririnig mo yung hirap na paghinga niya. And she complained about the very, very hot and humid temperature of the Philippines. I know that I can feel that as well, even right now. yung nakaraang araw, sobrang init paggabi or kahit ng hapon, those are actually triggering factors to making the bronchial asthma exacerbate really, really bad. Okay? Alam ng mga taong merong bronchial asthma ang sinasabi ko, that's how difficult it is for them actually. So changes in weather or temperature, you're cold or even you're hot, really doesn't matter. Basta extremes in temperature, it's going to affect your bronchial asthma. Environmental change, changing into a new home, starting a new school, actually even anxiety attacks can actually be a reason why or why a person is going to manifest signs and symptoms of your bronchial asthma. Colds and infection, yes. If it cannot be explained by triggering factors such as the ones that I have mentioned, these ones will likely be the very reason why the patient is in the hospital. Okay, because of your infectious process. Animals, cats, dogs, rodents, and horses, it's a good thing that despite the fact that people in the house are actually asthmatic. My mom, my sister, my two pamangkins at that. Kahit sila, even my rhinitis. Um, we have 16 cats by the way. Ang daming pusa. Pero despite that fact, um, we we actually bathe them and they're actually clean. So there's no problem with the triggering factor of the animal hair or dander or whatever. Kasi malinis sila. It's only my sister, yung sister ko na galing abroad. Siya lang yung nagre-reklamo lagi. She can, she can communicate with them, she can play with them, she can tolerate, but she could not carry them. She could not touch them. Basta merong social distancing siguro para sa kanya, tsaka kung nasa paa lang, ganun, kayang-kaya niya. Pero kapag hinawakan na niya, tapos kinera niya yan, sigurado kung maaamoy niya or malalanghap niya yung hair ng cats, yun, magsa-start na yung bronchial asthma niya. Okay? So that's it. And then we have another one, yung medications natin. We have certain types of medicines which also are considered allergic to another person or to some persons. And this might actually trigger you to have your asthmatic attack. Like for example, you have your aspirin, kahit yung mga NSAIDs natin na mga gamot, mga ibuprofen, mga mefenamic acid, yan. Pag ang mga pasyente natin ay allergic sa mga yan, pwede sila magkaroon ng hypersensitivity reaction. At the same time, your bronchial asthma, even your certain types of your antibiotics and B blockers, they can actually be a reason for the triggering of your asthmatic attack. I've mentioned kanina, di ba, anxiety, strong emotions. Yan. Actually extremes in emotions. Either fear, anger, you're laughing or crying. They can be triggering factors why a person is going to suffer from asthmatic attack. Conditions, if there are underlying conditions or, a person has your predisposed morbidity to a certain disorder, such as having your GERD or your tracheo-esophageal fistula or any other type, they can be triggering effects or triggering factors for your bronchial asthma. Food additives, yung mahihilig dyan sa mga nitrite, mga sulfite, tocino, whatever, yung mga, yung mga tapa-tapa, yan. They can actually be reasons for triggering of your asthma, especially with your food. Yan, mga nuts, milk, anything that has some protein content in it. Yan. Kasi yung protein natin, yan yung meron yung certain component which triggers your inflammatory response. It's the protein component that triggers your inflammatory response. Endocrine factors, anything that has something to do with your endocrine, especially your hormones, can explain why we have your triggering effect. So we have here your menstruation, your pregnancy, etc., etc. Okay, so these are your triggering factors why a person suffers from your bronchial asthma. Now, by definition, your bronchial asthma is caused by a recurrent. So when I say recurrent, hindi lang minsan. This is not one-time, big-time event. This is a vicious cycle of having your um, chronic inflammatory reaction by exposure to all of these triggering factors, causing you to have, what are the manifestations? You have your wheezing, ayan, hindi po nawawala ang wheezing sa patients na merong asthma. You have your breathlessness, you have your chest tightness, you have your coughing associated with airflow obstruction, yan, bronchoconstriction that may resolve spontaneously. Good enough if you are able to overcome it and you can resolve it spontaneously. However, if it becomes too serious enough for you to be confined in the hospital, that's where the problem lies. Specifically kung wala kang gamot. Okay? As long as you have your medicine, it can be reversible. Okay? But without the medications, patay kang bata ka. Yeah, ako ulitin ko. I am so lucky that um we have your nebulization and your bronchodilators on stock, or else hindi ko alam kung ano mangyayari sa akin ngayon. Okay? Next, we have your pathogenesis. So, okay, how do we have your asthma? It's because of that allergic reaction caused by your triggering factors causing you to have. Kapag mayroon kang allergic reaction, ano nangyari doon? It's your inflammatory response, right? With your immediate inflammatory response, katulad ng mga sinabi ko previously, you have your edema, you have your dolor, you have your calor, you have your function lesa. In this particular sense of your immediate reaction or inflammatory response, it's basically going to have an effect on your bronchial airways. So si bronchial airways, siya yung target ng ating allergic reaction. Siya yung target ng ating immediate inflammatory response. At kapag si bronchial airways ay naging target, anong expectin mo? Bronchoconstriction. Pag bronchoconstriction, makakahinga ka pa? Hindi. Kasi walang daanan yung hangin. Hindi ka din mag-inhale ka na mag-inhale dyan, walang dadaanan yung hangin. Okay? Apart from that one, you're also going to have your secretions, right? You will have your secretions. But more importantly, ang pinaka-problem mo dito is your obstruction. Kasi walang dadaan na hangin because of that obstruction. Or maybe, apart from the obstruction, you might even have your bronchospasms. At with your bronchospasms, you do not have that appropriate airway patency for your oxygen to actually, course through until it reaches your lungs or even your alveoli. Okay? So, mast cell release of histamine, ito yung nag-cause ng allergic reaction. Hindi ba naalala niyo yung in-explain ko na with your chemical mediators, such as your cytokines, your kinins, ayan, even your mast cell, the release of your histamine, okay, this is the one which actually causes you to have your inflammatory response. Basically, saan ulit? Doon sa bronchial airways. So what happens to your bronchial airways? You will have your bronchoconstrictive process. That's one. You will have your bronchospasm. And eventually, you will have your obstruction. So if this is, yan, ayan, sobrang liit na nga ng dadaluyan mo because of the structure of your bronchioles and your bronchi. What will happen more if you have your obstruction happening on your airways? So eventually, this is a very edematous, sobrang edematous. I don't think your air can actually, pass through. Nothing at all. No oxygen, no gas at all. Gas exchange is not going to happen here. Okay? So that is that's what's happening with your bronchial asthma. So triggering effects, I've mentioned already, you have your infection, allergen, exercise, irritants, etc., etc. And I did mention that because of your inflammatory response, which is going to be triggered again. Ano ba yung inflammatory response na nati-trigger when you have your bronchial asthma? It's your allergen, di ba? Allergic reaction, chronic allergic reaction. So we have your immunoglobulin, or your IgE. Okay? IgE. Si IgE siya yung nagsasabi sa chemical mediator na mag-release ka ng histamine. Yan. Kasi may allergic reaction ka eh. Ang immunoglobulin E pala is responsible for triggering your hypersensitivity reaction kasi E stands for allergy. So IgE, allergy. Okay? That's your IgE mast cell mediated response causing you to have a cascade of different releases of your chemical mediators such as, what's next? Ano yung nakikita niyo dito? You have your mast cells, eosinophils, macrophages. Ito yung mga immune system response mo. Kaya lang sa immune system response na yan, they will try to act on your inflammatory response. Kaya lang ang inflammatory response natin, it's systemic in nature. It's systemic in nature. So, yung systemic in nature na yan, hindi lang isang area ang pinag-uusapan natin. Hindi lang yung sa kamay mo kapag may allergy ka. No. We're talking about systemic sa buong katawan mo. Most especially in your respiratory tract. So, in this case here, the early phase response caused by that chemical mediator release of all of these things. You have your bronchial smooth constriction, muscle constriction. You have your mucus secretion, vascular leakage, mucosal edema. Imagine mo, lahat ng yan nangyayari doon sa bronchial airways mo. Kamusta ang itsura niyan? Hindi ba? Sobrang maga, marami pang laman, marami pang secretions. And you will have your mucosal edema. So again, no way that the oxygen can actually reach your alveoli, right? Okay, so eventually you end up having your obstruction of all of your areas, whether they are large or small. And because there's not just your oxygen reaching, yung carbon dioxide, naiwan eh, hindi makalabas, di ba? Kasi nga constricted yung bronchial airways mo. So pati yun, nagkakaroon ka ng air trapping, causing you to have an increase in the number of your carbon dioxide, and hence you have your respiratory acidosis. At kapag meron kang respiratory acidosis, ibig sabihin kulang ang O2 natin, di ba? Causing you to have decrease in your oxygen in the blood, causing you to have your hypoxemia. Okay? In late phase response, hindi lang 30 to 60 minutes ang pinag-uusapan natin dito. Okay, you have your infiltration of your eosinophil, mga WBCs natin. Inflammation is going to continue on. Bronchial hyperactivity will continue on. Infiltration with your monocytes and your lymphocytes, still a part of your immune system response, eventually causing you to have this same. Okay? Kapag nangyari yan, actually, kawawa yung mga bata na na-handle namin sa clinical area, specifically dun sa pediatric ward. Ganito talaga yung narinig namin. The wheezes are very, very loud. Just by listening to the breathing pattern, the breathing of your patient, adventitious bed sounds, sobrang lakas ng wheezing ng mga pasyente namin na naka-oxygen yung mga batang ito. Sa totoo lang, even the babies that we not babies, but yung mga 1 month, 2 months old, okay, sila yung nasa labas din. Naririnig talaga namin yung adventitious bed sounds nila. Okay, so that's your pathophysiology of patients suffering from your bronchial asthma. And there is what we call your status asthmaticus. Once we say we have your status asthmaticus, this is the worst case scenario of your, hindi naman worst case, but it's the it's a complication of an unresolved asthmatic attack. Pag sinabi nating status asthmaticus, this is a severe life-threatening asthma episode na even if you provide your treatment, there is still your problems of your refractory hypoxemia, and at the same time, it might result to your pneumothorax acute, cor pulmonale, or even your respiratory arrest. Bakit ka mo? Kasi kahit may gamot na naibigay para sa pasyente, even if with the medication that's given to the patient, there's no relief at all with your bronchoconstriction, with your bronchial edema, and with your bronchial obstruction. No relief at all. Why? The patient is not responsive to the medicine already. And your status asthmatic and your bronchial asthma attack has been going on for more than 30 minutes. Imagine mo ha, more than 30 minutes na ang nangyayari na difficulty of breathing, you have your wheezing, using of your accessory muscles for breathing, lahat ng mga yan, more than 30 minutes na. So, ibig sabihin nun, more than 30 minutes na yung patient mo na nagkakaroon ng bronchial constriction, bronchial spasm, you have your mucosal edema. Walang oxygen na pumapasok dyan. Eventually, you will end up having all of these things. Ayan. Okay? Anong gagawin mo pag merong status asthmaticus? You use another form of medication which might be more effective than the usual set of bronchodilators that you have. Okay? Clients who have your status asthmaticus are usually given with your racemic epinephrine. Because your epinephrine is not just only for your heart, it's also for your lungs. When it is given via your inhalation, we call it your racemic epinephrine. Kasi meron siyang mix na NSS plus your epinephrine, and then it is given through your nebulization. Your epinephrine also has a bronchodilating effect apart from it being an adrenergic agent. Okay? So, that is a very important treatment option for patients who have your status asthmaticus. You need to resolve the life-threatening episode of the asthma. Stat. You don't want to make it longer, drag it longer for a patient who has this particular condition. Okay? Assessment. Sabi ko kanina, all types of adventitious breath sounds naririnig mo sa kanya. Dyspnea, wheezing, breathlessness, chest tightness, coughing. All the works. That is actually seen with patients who have your acute asthmatic attack. Diagnostics, pulmonary function test. Ito yung spirometry natin ngayon. They're going to exhale, hold your breath, and they're going to check the calibration, how well your lungs is able to handle these extended moments of actually holding your breath. Ayan, that's your pulmonary function test, checking for how well your lungs is able to or are able to actually accommodate your tidal volume, those types of things that are expected during your ventilation. Okay, so next we have your diagnostics, your peak expiratory flow rate, either PEFR. Ayan, similar manner of your spirometry. Yung spirometry natin, hindi lang siya for diagnostics but also for treatment. Especially kapag meron kang pasyente na after operation, gusto mong malaman kung kaya ng pasyente mo ma-handle yung tidal volume natin. Okay? So, this one is through inhalation. Yung spirometry naman natin is via your exhalation. And then we also have this one, your metacolin challenge test. I have yet to see this one being done in normal medical center. Siguro meron sila, pero hindi ko siya nakikita kasi usually ginagawa to saan ba to ginagawa na unit? Baka sa pulmo unit nila. Meron silang specific room doon for diagnostics and your procedures in the pulmonary unit with your respiratory therapists or even with your doctors, mga pulmonologists natin. Okay, so it's an exercise challenge test. Gusto nilang i-check if the patient is indeed having your asthmatic attack because of your exercise-induced trigger for your bronchial asthma. Ayan. Ito yung sinasabi ko kanina. Okay? Then next we have, what are your assessment? Progressively worsening symptoms. Kapag meron kang acute asthmatic attack, bumabagsak yung expiratory airflow mo, nahihirapan kang magsalita, you have difficulty talking, you have speaks in short phrases. Parang ako kanina. When I was trying to do lecture, I need to stop several times because I really have difficulty in talking. That's why I had several nebulizations today. Okay, so I don't know. I need to go see a physician, but not right now because, oh my God, it's very dangerous outside right now. Okay, so please stay at home, guys. It's very important that you stay home. Next, we have your evidence of your air trapping, and then also your hypoxemia. I've explained that one already. Okay? Restlessness, apprehension is very obvious because you're losing perfusion of oxygenated blood to your brain. Sputum, none to clear, and even gelatinous. I've explained already your sputum structure, ano to, composition, and even your color. Auscultation, crackles to wheezes to diminish. Bakit ka may crackles? Because may laman yung ating alveoli. Bakit ka may wheezes? Because meron kang bronchoconstriction, especially if you do your inspiration or your expiration. Hanggang sa nag-close na talaga yung bronchial airways mo, wala kang marinig. That's where your status asthmaticus becomes very, very dangerous because your bronchial airways, at least with your wheezes, no, actually, it's really, really bad to say at least, but think about it. Why do we still hear something when we have your crackles or when we have your wheezes? It's because there is, a bit of your bronchial airway which is actually open, and there is an attempt of the patient to actually breathe in as much oxygen as it can. However, if there's full bronchoconstriction, imagine niyo, sobrang wala na talaga from this one, wherein at least you have, well, we can place, I mean, there is your edema here. Maliit na siya, right? But with your full obstruction, as in wala ka, oh, it's fully obstructed by your inflamed bronchial lining, that crackles to wheezes that you hear will now be gone, causing you to have, or eventually resulting for you to have your status asthmaticus. Nothing at all is passing through your bronchial airways. That's what's happening with your status asthmaticus, and that's a very dangerous situation, guys. Okay? Priority nursing action. Technically, what's wrong there with your bronchial asthma? There's obstruction in your bronchial airways. So what do? Palakihin mo. Make it big. Make it disappear. How are you going to do that one? Assess airway, patency, and respiratory status. Provide administration of your oxygen. But apart from that one, you need to have your medications, bronchodilators. Okay? Bronchodilate. From the term, bronchodilators. Bronchodilate. Okay. Either they can be your salbutamol, salmeterol, you have your theophylline. Okay. Please remember your medications, respiratory medications, which are very, very helpful in cases like this one. Initiate an intravenous IV line. Why? Because that's where you're going to give your medications, especially if you're going to give your um, intravenous corticosteroids. Like, for example, dexamethasone, betamethasone, prednisone, methylprednisolone. Okay? Prepare for your chest x-ray if prescribed, and obtain your ABG if prescribed. Okay? Why do you need to have that one? Your doctor would like to know, additional information if the patient is suffering from complications caused by your bronchial asthma attacks. Okay? Next, we have ito yung mga rescue medications para sa may mga asthma dyan. Alam na alam nyo, ito yung Ventolin natin, your short-acting B2 agonists or your bronchodilators, your anticholinergic agents for relief of your acute bronchospasms. Okay, like for example, your atropine sulfate, that's very, very helpful. Systemic corticosteroids, lahat ng mga zones yung sinabi ko kanina, those are your anti-inflammatory medications, which would likely help you decrease your mucosal edema, bronchial edema. Okay, so these are your rescue medications. And I did mention earlier, yung ating, if first comes to works, you have what we call your racemic epinephrine for patients who have your status asthmaticus. Okay? Yan. Kapag hindi mo nagawa ng paraan, Diyos ko Lord, yung ano na to, na hindi mo na-manage yung bronchial asthma mo, you end up having, actually, apart from your bronchial asthma, we have your COPD or your chronic obstructive pulmonary disease as one of your disorders which contribute you to actually having your acute respiratory failure. Kapag hindi mo na-manage yung mga problema na katulad ng bronchial asthma, which is a chronic airflow limitation disease, or yung mga chronic obstructive pulmonary disease natin, Yan. Pag hindi mo nagawa ng paraan ng mga yan, ito ang ending mo. Acute respiratory failure. Kung alam nyo, ang severity ng condition when it comes to your heart failure, di ba? Endgame yun ng heart natin eh. You also have an endgame for your lungs. And that's your acute respiratory failure. Unfortunately, sobrang bilis ito, guys. Sobrang bilis. So, there's no other option when you have your acute respiratory failure. It's about providing oxygenation stat to your patient. Okay, so hence you have here invasive mechanical ventilation as one of your treatment options immediately. Ito yung ating laryngoscope. Ito yung itsura ng ating ET tube. Ito yung ET tube natin. Papasok nila dyan. Yan. Hanggang sa, obviously may butas yun. Because dyan papasok yung ating oxygen in specific FiO2 flows. Okay? Hanggang sa makapasok siya doon sa, kung maalala nyo, ito yung trachea natin. Yan yung trachea natin, di ba? And then we have your bronchi. Ayan. Tapos yung mga bronchioles natin. Tama? Pangit. Basta yan. Yan ang itsura na. Now, this one, dapat hanggang dito siya. Ayan. Or hanggang dito. Okay? Hindi siya pwedeng hanggang dito lang. That's not going to be enough. Dapat hanggang dito yan siya. So that, when we are going to do your bagging, alam niyo yung ambo bag natin, di ba ipapress mo siya? And because the pressing of that bag will be your ventilation. Ito na mismo yung inhale, exhale. Manually, yan yung nangyayari. Pero kapag ito ay kinonect sa mechanical ventilator, yung mechanical ventilator machine mo will do all of the ventilation for the patient. Okay? Your mechanical ventilator machine is your artificial lungs, which will ventilate. They will actually have your inspiration, expiration for the patient. And it is very important that your ET should be in the appropriate space or in the appropriate area. Okay? So that, okay, your treatment options, such as these ones, will be very, very helpful in reversing your respiratory failure. Why do we have respiratory failure? Well, because there's not enough oxygen and there's just too much of your carbon dioxide, which is expected of a patient who has your bronchial asthma. Kasi nga, wala eh. Walang nakakapasok na oxygen. Okay? Your ICS is your intravenous corticosteroids. Okay? Corticosteroids. This Heliox administration, I'm not familiar, but it has something to do with the medication also that is being provided during your mechanical ventilation. Okay? Pero ito na sa libro, nakita ko siya. But for the others, yan, ginagawa talaga namin yan sa clinical area where nurses are very much familiar. Okay? But for the Helios administration, I think this is for the part of the respiratory therapists. Because, let's face it, your respiratory therapists are the ones who are very well versed with your mechanical ventilator. Okay, the nurses are there to facilitate your monitoring only, but the settings wise of your mechanical ventilator is not our call. Okay? Preventive measures for avoiding your respiratory failure. Ito yung mga gamot natin po. Corticosteroids, yan, paulit-ulit, diba? They are just similar medications with the other respiratory problems. Anti-allergic medications, antihistamines for that matter, long-acting B2 agonists, your bronchodilators, you have your leukotriene modifiers in the form of your Montelukast, Zyferlukast. Yan. This will prevent your bronchospasms and your inflammatory cell infiltration. Parang, I consider this one, ito yung mga maintenance kasi once a day lang to binibigay every morning. Okay. Maintenance medications para hindi ka magkaroon ng release ng chemical mediators causing you to have your hypersensitivity response. Mast cell stabilizers also blocks the effect of your immunoglobulin E para hindi ka magkaroon again ng release ng mga mast cells mo so that you will not have your cascade of your chemical mediators. Okay? So these are your excuse me. Preventive medications. Okay? Other interventions. Yan. Chest physiotherapy. After bronchodilators are actually given by a nebulization, you need to have your chest physiotherapy or your bronchial tapping. This is to facilitate the loosening of your secretions that are actually attached on your bronchial airways and even your alveoli. You need to remove all of those secretions para mas magkaroon ka ng um, clear airways for your gas exchange. Allergen control is also very, very important here because one of the reasons why you have your bronchial asthma or even a worsening conditions of your respiratory disorders is because of that hypersensitivity response. You don't want inflammatory response to actually be triggered because it will only make the matters worse for your patient. Increased fluid intake will also facilitate the loosening of your secretions. Hence, unless contraindicated and told by your physician, you will continue to do so with your hydration. Flu vaccination is also very, very important. Kasi nga, di ba, one of the reasons why a patient is actually suffering from bronchial asthma or even your respiratory disorders is because of the presence of your infectious process. You don't want that to happen to your patient before it actually, you know, before your patient is able to contract the disease and make matters worse for your bronchial asthma, dapat nagkaroon ka na ng preventive measures such as taking your flu vaccines. Okay? If I'm not mistaken, this is done like yearly. Katulad ng pneumococcal vaccine natin for your pneumonia. Okay? So, I think that's it for our bronchial asthma.